afternoon, everyone. Really excited to see this many people in here, and I'm excited to be your moderator for today. So thank you for joining. Welcome to the 2024 Culture of Data Conference. My name is Theo Abbey. My pronouns are he, him, and his, and I'll be moderating this session, as I said earlier. We also have Dennis Wright, pronouns he, him, his, who's managing the Zoom to make sure that our tech is running smoothly. You are all muted now, but if you have a question during the Q&A, please feel free to unmute. We want to hear folks, or you can also use the chat box if you have questions or need anything, if you're comfortable doing so. So please add your pronouns to your Zoom as well, so that we are all being very inclusive in this environment. And you can do so by clicking the three dots on your video square and selecting rename to put your pronouns in. So we have one presentation for you during this session. They will present for approximately 25 minutes, and then there will be a 10 minutes for Q&A afterwards. Personally, as a current resident of Arapahoe County, I am extremely excited about this presentation and very poised to learn about the methodologies and strategies that were utilized to address substance misuse disorder and housing challenges, which I am very familiar with in this county. And I hope that you're all equally excited to hear. We see a lot of homeless folks out there. And so this is really speaking to our hearts here today. And so without much ado, I'm going to introduce our very distinguished Tanya Serrato to present on data-driven equity in Arapahoe County, tackling housing and substance use with health. So with that, I turn it over to you, Tanya. Thank you.
Well, thank you so much for the presentation and the introduction. Theo, can you see my screen? Wonderful. Well, thank you so much, and good afternoon, everyone. My name is Tanya Serrato, and I am the Population Health Data Science Manager at Arapahoe County Public Health. And I'm very excited to present one of our projects in Arapahoe County, the Health-VISTA, which started in January this year. The acronym Health-VISTA stands for Visual Integration of Science, Technology, and Analysis, capturing our project's approach. But also the name represents a human perspective because Vista, meaning sight in Spanish, is ensuring us to focus in real people behind the data. Let's get started. These presentation goals are identify public health challenges in Arapahoe County, such as substance use disorder and housing issues. Analyze the project methodology, which focuses on data aggregation, analysis, visualization techniques. And lastly, we also talk about what our findings mean for public health and how these strategies can be used in other places to help people suffering with substance use disorder and housing insecurity. Let's start by exploring the essential relationship between a stable housing and overall health. Stable housing is more than just a place to live. It's a foundation for good health, education, and employment for all of us. However, for people facing substance use and mental health problems, having a secure place to live is crucial. Let's look at the numbers. In the United States, one out of every 5 homeless people is dealing with substance use disorder or mental health issues. And 2/3 of the people facing chronic homeless are also managing substance use disorder or dealing with ongoing health conditions or disabilities. This statistic is not just numbers. It represents individuals with stories, struggles, and the need for support. Let's review key findings from the 2023 Arapahoe County Homeless Report by the Metro Denver Homeless Initiative. This report is based on the point-in-time count on January 30th, 2023, capturing homeless status that night. it found that 442 people in Arapahoe County and 572 in the city of Aurora without homes. The report highlights the substance use disorder and mental health issues as a primary challenge to securing housing in Arapahoe County in this specific population that night. Additionally, it shows that significant racial disparities. Native American or Alaskan Native residents are 5.3 times more likely to be homeless, and Black or African American residents are 2.2 times more likely. Let's review the current state of housing affordability in Arapahoe County, which critically shapes any public health approach to addressing homelessness and substance use disorder. We observe a significant 16% of increase in median home sale prices in Arapahoe County in 2023, making home ownership increasingly unreachable for many. And only 20% of Black African American and Hispanic residents in our county own homes versus 71% for white non-Hispanic. Additionally, 6% gap exists between monthly income and rent costs, stretching budgets and amplifying the risk of housing instability. But we recognize this complex nature of substance use and also housing insecurity and homeless and their impact in public health. But Arapahoe County, one of the Arapahoe County approach includes using data science to inform decision-making. And this is the Health-VISTA project, supported by the Council of the State of the Territorial Epidemiologists, the Data Modernization Initiative's goal to enhance our public health team's expertise in data and improve our response to urgent issues. But let's explore the goals and objectives. The goal of this project is to deliver a predictive toolkit with an index score to identify areas in Arapahoe County at risk of housing insecurity and homelessness, but focus on residents with substance use disorder. The core objectives include use analytics to uncover trends for proactive interventions, guide decisions, simplify data into easy to understand insight, optimize resources allocation efficiently. To exemplify our approach, we refer to models such as the CDC's Social Vulnerability Index, SVI. This model obviously is developed at national level, but we are inspired by this national model. And we are trying to adopt similar methodology, but tailored to our local context and needs. Let's talk about the methodology. Our approach includes 3 phases: the data aggregation, which focuses on gathering data sets, as many data sets as we can containing substance use disorder and housing data. The analysis phase. During this phase, we review this data to identify trends through descriptive analysis as well as predictive modeling to define substance use disorder and housing indicators. And then the visualization phase is in this phase in which we're going to transform insights into a dashboard using Power BI and ArcGIS. To build the overall index score, the core of this project, we are following methodologies similar to those used by Michelle von Hendel in other local departments and jurisdictions based on 3 elements. The first is the indicator identification. For this specific indicator identification, we are employing machine learning methods. The purpose is to identify leading indicators of substance use disorder in relation with housing insecurity. The second step is the index score formulation. In this, we are trying to calculate a predictive overall index score for each municipality and district using previously identified key indicators. And the third step is the ranking projections, is developing a predictive ranking system, assigning an overall index score to identify areas at risk in Arapahoe County. An agile project management style characterizes our methodology, featuring 4 or 5 weeks sprints to ensure flexibility for emerging data in trends. But the implementation of predictive analytics using machine learning in public health is complex, but also is an iterative process, which means we refine each step continuously. In public health, it's essential to make decisions that are equitable and inclusive. There are strategies to mitigate historical bias in the field of machine learning, which I will explain next. But the core of applying justice to this method is to involve stakeholders and community representatives at the center of this cycle. Each step of the process can benefit from these strategies. As an example, in the first step, which is data gathering, we can involve mitigation techniques as, for example, collect diverse data, or strategies that include a stratified sampling or feature selection to represent diversity in the community. After exploratory data analysis, the next step is the model selection, in which this next step to apply bias mitigation. Here we are employing methods like Form L reweighting and regularization. The next step is applied bias mitigation is the model evaluation. During this phase, we can use fairness metrics such as demographic parity, along with cross-validation techniques to ensure consistent accuracy across different groups. As you can see, this cycle can be repeated several times from the data collection to the deployment. In this case, we are intending to find the housing and substance use disorder indicators through using machine learning. We can revisit and refine each step as often as necessary to ensure that we are identifying the most precise indicators for building our overall index score. And here's our timeline for Health-VISTA project. In January 2024, we started with the Health-VISTA project. We are here focused in the initial exploratory data analysis, or EDA. As we move into May and June, we will focus on deep analysis of the data. By July, we were testing our first functional prototype. And our journey will finalize in December with the full launch of the project. But let's talk now about the current phase that we are in the project, is the data aggregation. So far, we have identified the following data sets containing substance use disorder and housing data: the treatment episode data set, SEMSA, the Arapahoe County eviction data sets, foreclosure data, house and urban development statistics, births, and NEMSIS. We are also in the process of engaging stakeholders, subject matter experts, and others to gather information. The process of data acquisition and the creation of the data lake house or data lake have also occurred in this phase. And this graphic aims to explain everything we accomplished at this phase. With the help of Arapahoe County IT team, the relevant information from these data sources has been extracted. The extracted data then is transformed into cloud storage. Next comes the transformation process, where we model our data to fit with into our analytic needs. Once transformed, the data is fed into the BigQuery. This is our powerful engine where massive data sets are processed at remarkable speed. At this stage, we are using a visualization locker, but during this phase, one of the challenges we face is the availability of local data in Arapahoe County, containing housing insecurity as well as a substance use disorder. Next, let's talk about our initial the data analysis, or ADA. Since this is our first data set in play for exploratory data analysis, I want to mention some findings from the treatment episode and data set admissions and discharge tests A and tests D. This data set tracks treatment provided to clients dealing with substance use disorder across the United States. Many of the facilities that report to TEDS, they receive funds from federal block grants to provide substance use disorder and drug treatment. But it is important to approach this data with care. While health is an important resource that has supported many related research and helped to develop machine learning models in the past, it tracks admissions and discharges rather than individual clients. The following are three important variables to define before moving forward in this presentation. The first is independent living, includes private residents or clients in private residence capable of self-care with or without support services. The homeless living variable includes no fixed address, including shelters, for example. And the dependent living includes supervised living or minor with guardians, and also clients in foster care or those that are living in different fields. This slide represents the results of the descriptive analysis from our initial exploratory data analysis, which is one step in the machine learning process. This EDA is not intended to provide assessment or individual risk or predictive outcomes yet. This is one step in the machine learning process. In our exploratory data analysis of 20,566 treatment episodes, alcohol use disorder is the most common diagnosis for people living in all situations. But homeless clients show the highest prevalence at 73%, followed by substance-induced mental disorders at 14.3%. In both independent living scenarios, alcohol use disorder was the most common, followed by opioid use disorder. This slide gives us a snapshot of 2021 TEDS demographic around Denver, Arapahoe County, and Arapahoe County, including Aurora. These figures before us reveal some disparities. For example, 2/3 of American Indian and Alaskan Native clients show records of homelessness. 45% of record of Black African American clients indicate a lack of stable housing. For those ages in aging 55 and 64, the rate of homelessness is double than for younger demographic, and homelessness rates in treatment episodes are triple for clients with no income compared to those with income. Around 64% of treatment episodes for clients with little or no education resulted in homelessness. Even when we recognize these are rates that are just the tip of the iceberg. So we want to learn about more data related to social networks related. Here we are looking at the initial insights for the initial exploratory data analysis, a multilinear regression model applied to our data set. But let's clarify this with a concise real life example. Imagine a school is trying to predict a student's final grades based on the number of hours they studied each week. Using linear regression, the school could develop a formula that essentially says for every extra hour studied, a number of a student final grade increased by a specific number of points. In this case, the number of study hours is the independent variable, and the final grade is the dependent variable of prediction. In our treatment episode data set tells a scenario similar to predicting grades. We are using linear regression to predict whether it is dependent or independent living or homeless based on some factors like race, ethnicity, patient diagnosis, marriage status, education level, current IV drugs, number of prior arrests, admission, primary income. Each factor is like an extra study hour and influence the final grade, which in our case will be dependent variable or homeless dependent living or independent living. Once our model is trained, we can use it to predict the living situation for new clients in a new data set, for example, for 2021 data set. But now let's explore the confusion matrix. One side of the list lists the actual living situation of clients after treatment, and the other side lists what the model predicts for these clients. Where the two met, which is color blue in this graph, the chart shows how often the model was right. In our case, it was correct about predicting homelessness 84% of the time. This slide is another modeling algorithm, is the random forest. We use random forest here because it is good at dealing with complicated data as substance use disorder and housing. So this data set has interlinked and complex factors. So random forest builds many decision trees and combine their findings, which help us in accurately identify patterns that affect living situation in this case. The future importance analysis for this model, which is a technique used to identify the rank of relevance of different variables in predicting an outcome, has identified key factors that influence the prediction of living arrangement in this data set. The most influential factors include primary income and treatment diagnosis, followed by education level, marriage status, length of stay, current intravenous or IV use, prior arrest, and race ethnicity. These factors will serve as a foundation for deeper analysis, which will help us to build all our overall index score in the future, probably in July. In addition to this model, we has been less successful at predicting homelessness. However, it shows better accuracy forecasting independent living scenarios. This slide represents our initial use of Looker Studio for analyzing Arapahoe County Sheriff eviction data set. As we complete our analysis, we will develop interactive dashboards. While Looker Studio is our primary tool for initial data visualization, we are planning to expand our toolkit to include Power BI and ArcGIS for advanced geospatial analysis. Let's envision our journey, which is still a long way to go. Currently, we are here in the process of reaching out to local public health organizations to collect local level data set containing house and substance use disorder data. Also, we are beginning to engage with community and stakeholders. The next steps include preparing for the prototype testing, which is include finalize the substance use disorder and housing insecurity indicators identification and build the overall index score. And also, we are in the process of conducting team trainings and developing skills in this DMI. As we progress, we will formulate strategies to disseminate the toolkit through Arapahoe County and CSTE. But we wrap our presentation by highlighting that the initial TED exploratory analysis has identified income diagnosis at admission, current IV drugs use, education as key influential factors in predicting living arrangement, as well other factors, for example, race, ethnicity. But further analysis is needed to better understand those factors. Together, we advance We want this presentation to serve as a strong call to action on two significant public health issues: housing insecurity and substance use disorder, creating a public awareness and implementing actions from data perspective. If you are interested, or if you have any interest in collaborating with this project, from data analytics to firsthand experience with housing insecurity and substance use disorder, your involvement is crucial. Here, you can share your skill with us, contact us. Here is the team. Thank you so much for this amazing team. This is the DST team for Health-VISTA. Also, I want to say thank you to CSTE Mentor, as well as our innovator leaders in Arapahoe County, Heather and Jennifer, as well as communication teams. Thanks. Thank you so much for your attention.
Oh, wow. I wish we could clap for her, but I can't see. Just throw some love in the chat if you can. Thank you, Tanya. I live in Arapahoe County, so this really means a lot to me when I'm driving and seeing people pitching their homeless tents. It's really sad to hear. So thank you so much for that. We're just going to move to Q&A. We only have 10 minutes. Please feel free to put questions in the chat, and then you might also unmute yourself. I love to talk, so I'll unmute. So please feel free. You can unmute and ask your questions.
Hi, I was wondering if you could go back to the slide with everyone's contact information so that I can pull that out quick, and because I would definitely be interested in being a part of this. So thank you.
Wonderful. Do you have experience working with substance use disorder and housing insecurity?
So for 3.5 years, I worked with youth experiencing homelessness. And now I'm a student in the Colorado School of Public Health. And my goal is to work towards work on housing concerns. So
Amazing. Is wonderful. Gather your information, and you're welcome to share your experience with us. So you can contact us. Thank you.
awesome, thank you.
Nobody has one. I'll throw one out there. I think, in my experience as a public health professional, especially around substance use, sometimes folks are inclined to really seek that care if they really know that they can relate to the doctor. And this might be far ahead in what you're doing. But also, I think those are some of the things that are important is, making sure that there's some cultural representation of the folks that will offer any type of care. Because, in my experience, sometimes being an African-American male is not enough because I'm attached to the state and things like that. So just wondering if you guys are looking specifically into some of that so that you can have the real life experience, right? I saw Hispanic, I saw Black African Americans as the ones most impacted. So is that something that you guys are looking at?
Yes. The core of this project is to especially work with data related to improve health equity. So the idea to apply machine learning and apply all those bias and mitigation bias techniques is to be fair, is to identify the real population that historically has been left behind, especially when using machine learning techniques. So the idea is be able to identify and predict when and where vulnerable populations are going to be at risk in our county using machine learning. And yes, the idea also is to involve during this process of machine learning communities. In the communities, that are affected right now for housing insecurity and substance use disorder, as the presentation and the data show us, is Black African American as well as Indian American, Native American.
Thank you. Looking in the chat to see if there's any question.
Nothing in the chat at the moment, but I'll keep my eyes peeled.
And as we have about 4 more minutes for questions. So we'll just wait and see if folks have, I had some announcements. I can jump into that if you think that's appropriate.
I believe so. If we're ready to have more conversation, we can stick around, of course. We can have people kind of reclaim their time as well.
Okay. All right. So again, then I can say thank you all for attending this session. I've learned so much, and for engaging in the Q&A. Please, this is not where it stops. So Tanya, if we have questions, we can email you and send them to you as well.
Yes, absolutely. You can contact us, and here you have our emails, Arapahoe County Public Health.
Awesome. So slides and additional handouts are available on the schedule. You will receive a conference evaluation. Please put something in. I think that was an awesome presentation. There will be a raffle for everyone who completes a survey. You may get a $50 gift card. And please invite me if you go eat some steak. So again, thank you. Thank you for joining us. We'll now have a 15-minute break before the next concurrent session that starts at 2:30. All right. And there are 3 sessions that you can choose from for the next sessions. The first is, don't forget, a debrief session for some casual networking and fun trivia stuff that's going to be happening at the end there. And so I think that's all I have by way of announcements, Dennis. Do you have anything? And Tanya, do you have any final words for us?
Well, thank you so much for the opportunity to have a conversation from the data perspective into public health issues affecting us right now, is substance use disorder and homelessness and housing insecurity. And thank you so much for the opportunity from the entire team in Arapahoe County. Thank you so much.
Man, thank you very much.
All right. So without much ado, you get a little break, an extra break, actually. You get extra 20 or so minutes. Thank you. It was a pleasure. Thank you. Thank you.